The psychological effects on Hurricane Katrina survivors. This is Karen Nix, a survivor of Hurricane Katrina, which made landfall in August of 2005. Karen Nix was working at Tulane Medical Center when Hurricane Katrina approached New Orleans, Louisiana. Although, unlike many of her co-workers, Nix suffered from a disability which made her extremely immobile during the disaster. Nix characterized her time during the disaster as being miserable. However, Nix is one of the thousands of survivors that was not only impacted physically, but mentally as well. On January 12, 2010, Haiti experienced one of the most devastating earthquakes to ever hit the country. Unfortunately, it is estimated that 230,000 people lost their lives in Haiti. The survivors of the Haitian earthquake all had a myriad of physical and psychological repercussions that occurred from the disaster itself. Although, what set Haiti apart from the millions of others that have experienced a disaster is their willingness to accept the conditions and move on. Resilience is what set Haiti apart from the millions that have experienced a disaster. Although many of the Haitians were characterized as being resilient, many citizens were affected in adverse ways. Similar to Hurricane Katrina and its survivors, Haiti decided to move forward for the better and make their home a safer place going forward. So now we're going to start with some background information about Hurricane Katrina. So it occurred on August 29th in the early morning hours of the day. Although there were not millions of deaths that occurred from Hurricane Katrina, it is estimated that 1.2 million people were affected in some type of way from Hurricane Katrina. So there were a variety of factors that affected the population after the hurricane hit. And according to Jeffrey Medlin, it is estimated that 80% of New Orleans, Louisiana was under storm waters by August 31st. So Hurricane Katrina ushered the way for survivors affected to experience some type of psychological distress post-disaster. According to Sarah Pruitt of Princeton University, there is approximately 1,833 lives lost from Hurricane Katrina's repercussions. Although you might think that's a small number compared to the size of New Orleans, there was a myriad of factors that affected the physical and mental well-being of survivors after the disaster. So the various difficulties, both physical and mental, that survivors have dealt with draws us to the question of what are the mental effects on the mental well-being of post-Hurricane Katrina survivors? After Hurricane Katrina hit along the Gulf Coast, there are major gaps in mental health care. So this is due to healthcare facilities being unable to provide services needed for survivors after, mainly because most of the resources were shut down or were affected by the storm. Colton Craig of Louisiana State University also mentions that these major gaps were extremely noticeable in mental illness. And Ghislaine Boulanger of New York University also reports that each year after Hurricane Katrina had hit, anxiety, depression, and avoidance grew each year. In fact, due to the gap in healthcare, after Hurricane Katrina hit, the rate of suicidal ideation increased from 3.1% 5 months after Hurricane Katrina had hit to 7.9% 2 years following the disaster. Marianne Mazak, who is an award-winning journalist for the New York Post and many other publishing companies, reveals that mental health problems caused by Hurricane Katrina can come in various forms. Although over time and research, she found the most common were depression, anxiety, or PTSD, also known as post-traumatic stress disorder. So this brings us to the question of, how do we prevent the major gap in mental health care following a disaster? A possible solution to the gaps in mental health care following a disaster would be making the Crisis Counseling Assistance and Training Program more accessible for survivors to get the help that might be needed. So you might be asking yourself, what is the Crisis Counseling Assistance and Training Program? Well, the Federal Emergency Management Agency implements the Crisis Counseling Assistance and Training Program to help fund mental health care to those that have gone through a major disaster. The CCA's mission is to assist individuals and communities in recovering from the psychological effects of a disaster. The CCA also makes counseling available to any survivor who has been impacted by a disaster at no cost at all. The CCA's services are available at any of the accessible locations they give survivors after the disaster has occurred. Unfortunately, to every solution, there are some limitations that do arise with the Crisis Counseling Assistance and Training Program. One of the major limitations being, it's only in the United States. Therefore, for countries like Haiti or any other country around the world, they really don't have that opportunity to get the mental health care that they might need. Which having a gap in mental health care or health care in general is obviously very common and evident after a disaster has occurred. And another limitation could be that the fact that the CCA is really not a well-known resource. Even though the program is an amazing resource for people to use post-disaster, it's not conveyed to the public quite as much as it should be. For me, I have never been through a major disaster, but I've never heard of the CCA, so I think maybe if they just make it a little bit more apparent to the public and so people know that there's something out there that can help people with mental health after a disaster, it can really save a lot of lives and spread it around the world. Therefore, if the Crisis Counseling Assistance and Training Program is implemented around the world, survivors will be able to close the gap in mental health care following a disaster and also slowly build up resilience for their country's future. Thank you.
Can you give her a quick hand? First research question on the reflection of your research process. What evidence did you gather that you didn't end up including in your IMP, and why didn't you end up including it in it?
So some of the evidence that I actually gathered towards the end of my research was that not everyone actually goes through a psychological effect. So there's low levels of baseline psychological distress in a lot of the survivors that were impacted. So I guess that's one of the major things that I found that I wasn't really sure at the beginning. Obviously not everyone is going to be affected, but I think for most of my research and throughout my research, it really showed that there was a lot of psychological distress in a lot of survivors, but that is one thing I chose not to include because it really didn't align with my research question and what I was trying to convey to the audience. So.
Okay. And my question about extending your argument, what additional questions emerged from your research?
I guess one of the major additional questions that I actually was thinking about was, obviously New Orleans was not the only place that was affected. So it was all along the Gulf Coast. So I guess all I really found was people in New Orleans, the people that were affected there, but obviously there was other cities along the coast that were affected. So I would have liked to see more data and numerical data showing kind of what their psychological baselines and what that shows.
Okay.